Hello, this is Jeffrey Fox. I'm the instructor of the Big Data Applications and Analytics course, sometimes called X Informatics, and we're doing health or medical informatics in this lesson, which is lesson 2 of the whole section/unit. And let's move on to see what's in lesson 2 in the next slide, which just states rather sparsely what we have. It just covers trends of costs and types of healthcare, the overall situation we're trying to deal with. We mention positively things like the government brain initiative, role of social media, and possibly it's good that the population is aging. For people like me who are aging, and maybe I feel good about that. Okay, let's move on with lesson 2. All right, here is some overall status of healthcare. It's very high. A fraction of the gross domestic product is devoted to healthcare, 17%, or $2.8 trillion. And it's increased a factor of 2 as a percentage of GDP in 35 years. It is thought that 27% of that money is wasted in some sense, either unnecessary services, lots and lots of bureaucracy, missed opportunity for prevention. I'm surprised this is actually so small, and the largest amount is inefficient delivery. Actually, none of it's fraud. That's sort of interesting that fraud doesn't appear on this list. Maybe it really is small. If you look at who pays for it, some of it's paid by employers, 620 billion. Which is up 28% in 5 years. That's quite high, and so it says that 67% of company financial officers indicate that healthcare is a significant problem for the company. So currently, for 25% of family income goes into healthcare, and estimated in 2015 versus 18% in 2005. And if you look at the top 5% of consumers, those with lots of chronic illnesses, such as too many courses to teach and things like that, they spend 50% of the healthcare dollars. That's the 2009 statistics. And 50% of personal bankruptcy are driven by healthcare costs. These are just a collection from our favorite source, KPCB, of anecdotes or what have you about healthcare. So 75% of healthcare expenditures is on chronic conditions with cancer, diabetes, and heart and hypertension and stroke as these conditions. 50% of Americans have at least one chronic condition. 1 in 4 has 2 or more, and 32% of Americans were obese in 2008. And that was up from 15% in 1990. And all of this is due to our bad behavior. We are bad people. So we ignore all the ways we could solve these problems. We listen to silly videos about big data rather than running around the track. We do all sorts of naughty things. And so that's these 52% who did not do what they ought to do with physical activity. And also 50% of those with chronic conditions that don't take the right medicine, and $100 billion avoidable hospitalizations. So we're making our own problem. Here are some positive trends, looking on the bright side. So we have people using electronic health records. 84% of hospitals and related areas are using EHRs, and over 50% of office-based practices. People, of course, like email. 62% for healthcare concerns. So it's good to receive your email from the doctor. Hi, we got your report. You have another couple of days to live. Please come and see me. All right. There's lots of money being invested in digital health. It went up 39% from 2012 to 2013 to 1.9 billion. And quality is being emphasized over quantity. Payers are incentivized to engage patients, to improve care, to focus on outcomes and reduce costs. So that's the insurance companies, the providers, the hospitals are shifted to value-based and rather than fee-for-service payments. Employers are lowering costs by offering services to improve engagement and choices in care. 46% of employers will enact participatory and outcome-based incentives like weight loss and cholesterol levels. By 2015, 60% will price transparent tools from health plans. So here are various particular things about employer engagement platforms gives a 4-to-1 return on investment. Here is a comment about telemedicine, $798 savings per consultation over 30 days. And here is some comment about this Mango Health has got an application which increases to 84% the adherence to a certain class of drugs. And here we have a chronic disease platform which is improving diabetes care. All right, so we've seen this diagram in various forms. Now there's a slightly specious reduction here, which is not present on NIH's plot. NIH's plot continues rather more discreetly. We have that somewhere else. But anyway, this comes from the $1,000 genome number, which comes from a slightly exotic piece of technology, which is not clearly the deployable technology. But anyway, we'll soon be at less than $1,000, which is pretty interesting. So it's believed that genetics and genomic testing can give you a new paradigm of precision medicine that is based on quantitative and evidence-based science. So that's encouraging. But still, I don't think the genomes are a critical part of the healthcare practice today. Here is this $1,000 genome. There's this set of Illumina devices here, and here's some Forbes article announcing the $1,000 genome, and it's 2014, January 14th. So this comes from this SlideShare article, SlideShare presentation by Stephen Tucker here, which is full of useful things. Here we are. We all, well, obviously we're all getting older, but there are more of us are getting older and staying alive even when we're 85 or more, which is obviously having some impact on healthcare, because the older you are, the more likely you are to have made some of these had some problem, either unavoidable or avoidable, and therefore you're going to have more things to worry about. Here's some comment on the quality of U.S. healthcare, which doesn't look good. Here we are at 17% GDP, $7,000 spent per person, or $7,300. And here's our life expectancy, less than 80. And up here we have all these other countries, almost all other countries, in fact, which are actually higher life expectancy. So Korea, United Kingdom, Germany, Canada, Norway, Switzerland, France, Australia, Iceland, and Japan. So that's an interesting feature. Presumably says we spend our money in different ways and do a different optimization. So healthcare data is enormous and very valuable in trying to address this issue, either finding out why we're here, we're better, be good to be over. Maybe we can spend that amount of money, but we ought to be over here, maybe, or at least over here, 90 or something. Okay. Here's some interesting comment on the data. We have 500 petabytes of medical data in 2012, and it's meant to reach 25,000 petabytes in 2020. Pretty big growth. Here is a goal of big data in health care. We have we have electronic health records. We have public health studies and epidemiology. We have genomics. I would actually add images here. We have images. Don't quite know where they appear here, because they're a large part of the high data volumes. We have behavior running around the track. This gives you, then you run your analytics and you get insights which improve health and lower costs. That's the hope, of course. We're meant to try to find ways of putting all this together to run the best big data analytics and get the right answer. And of course, the goal is personalized medicine, and it's meant to impact all. We're meant to be able to use big data essentially at all parts of the process. The patient's data itself, the doctors with store of wisdom based on previous data, insurance companies' input to be able to decide what to pay, and hospitals, of course, that's similar to doctors. Okay, here is another trend, government brain initiative, $100 million research initiative, understand the human brain. It is much larger, in fact, in Europe than this. I think it's well over €1 billion there. And it's slightly controversial, I think. It's not clear that people agree that this is going to actually have the impact that is claimed. And it's obviously meant to work on particular brain disorders such as Alzheimer's disease, epilepsy, and trauma-related injury. And of course, the brain is notable for producing huge amounts of data. It's a giant neural net. So it's full of data which can be measured. Much more data probably than most other parts of the human body, which is smoother. The point about the neural net is that neural net is sort of presumably jiggling around, and each neuron has got, in principle, new independent information. So obviously it involves NSF, NIH, DARPA, and other organizations. All right, here's a nice concept that which is a general concept of visualization. We actually did this in sports informatics. We showed how in sports informatics, you can use spatial visualization. This is space. And you put layers. In the case of Google Maps, the layers are the streets and the weather and the traffic and things like that. And in the in the case of tennis, it was the shots. In the case of actually basketball and football, it was also the shots. And of course, you can put the people and all sorts of other things. But here, the overlays are less obvious, and in fact, it's probably an interesting. There are people who do research on the right way to use this concept of a space, which for people to look at it is preferably 2D and at worst 3D, and then on that space you have overlays with lots of different information. And here's some things here which we can do. Patient data. We have patient data, genome. I don't know some of these things exactly what they do. You can look them up and see what's meant to be in these layers. But the concept of a visualization of this is pretty interesting, and good thing to see what we can do. All right, here about medical errors. So this is a number of deaths due to medical errors. It's unfortunately this latest estimate here is over 400,000. So this is obviously outweighs other forms of death. So it's bad. Here's a nifty title page for Time. Can Google solve death? As it solved every other problem we have. So Google has health initiatives. Some of them they just restarted, but anyway, they purchased this company Calico, and it's going to have an R&D facility focusing on using data to solve solve health problems. Here's the final slide. It notes that if you look at data for Twitter messages or trends, which are effectively, presumably, either Twitter or just more general search queries, you will find that they're strongly correlated. The same is true with earthquakes. Whenever you have events, or I don't know, winning sport events, all these events are highly correlated with peaks in appropriately selected Twitter messages. So whether that's actually useful is nifty. It's certainly fun to know. Whether it's actually technically useful, I think, is not quite so clear, but it's certainly worth knowing. So that's the end of this lesson, which discussed some overall trends, which is framing the big data in health and medicine discussion. Thank you very much. This is Jeffrey Fox in the Big Data Applications and Analytics course, signing off at the end of lesson 2. Thank you.